should be approximately 45 degrees. All right, the C1, C2 articulation is very important because it contributes 50% of overall cervical rotation. We also need to be aware that at C1 you have the vertebral artery passing up through the foramina, to then pass up through the foramen magnum to supply the posterior part of the brain and cerebellum. All right, and when we come to sort of testing the patency of the artery itself, there are specific tests that we can do to ascertain whether there is good blood flow going up through the vertebral artery or not. And this is an important aspect because if you've got reduced blood flow going up through the vertebral artery, then obviously that's going to make the patient dizzy. And any history of dizziness is going to be quite an eye-opener to you. So you must carry out a specific test to ensure that the blood flow is good at all times. If it's not, then you're going to have to refer that patient on where they can do Doppler scanning to assess the blood flow going up through the artery. So, do look at the rest of the facets. If you've got a spine like this, it's a good idea to see what these angles are like. And then when we look at the rest of the cervical spine, you can see that the facets are all relatively angular. They're at roughly a pitch of about 45 degrees, which means that there is no pure movement like there is at the OA and C1, C2, whereas from C2 down to C7, those facets are designed for multiple functioning. So they contribute to flexion, extension, side bending, and rotation, which allows us to move through a good range of movement when we're looking over our shoulder. Right? It's always part of the survival mechanism, so you can make sure you can look over your shoulder and see there's no one creeping up on you. Right? So that could be quite useful at certain times. Now again, I just must emphasise the blood flow going up through the artery here. So you've got the vertebral artery. If you look at the slide on the right-hand side, you can see that the vertebral artery enters the cervical spine at C6, and then it passes up through the foramina, and then eventually up through the foramen magnum into the cranium to supply the posterior part of the brain. So close to it, in the front, you've got the common carotid and the internal carotid arteries. So we need to be aware that these structures are present when we're actually working on the neck. But obviously, we don't want to reduce blood flow one iota. The techniques we use today are designed to do that. Likewise, when we're working on the musculature on the anterior part of the cervical spine, obviously, we would need to use techniques to avoid compressing these vital structures.